Hey everybody, it's Chad again. So in this video, we will be continuing our HIV 101 education by going into treatment options for HIV. And so the next few videos will actually cover 3 different types of treatment options. The first 2 will be treatment as prevention options, and then the last will discuss treatment options if you test positive for HIV. So in this video, we will be talking about PrEP, or pre-exposure prophylaxis. So this is a medicine for people who are at risk for getting HIV to take to prevent them from getting HIV from sex or injection use. And when taken consistently, it is very effective for preventing HIV. How effective? It reduces the risk of HIV by about 99%. So, but there's less information about its effectiveness amongst people who inject drugs. But what is known is that PrEP reduces the risk of getting HIV by at least 74% for that demographic. So how long does it take for PrEP to be effective? So maximum protection from HIV is reached for receptive anal sex / bottoming at about 7 days of daily use. For receptive vaginal sex and injection drug use, about 21 days. So you may have the question of, well, is this for me? So to assess whether PrEP is a fit for you, here are some questions to ask yourself. 1. Have you had vaginal and or anal sex in the past 6 months? If you have, do you have a partner who is living with HIV? Especially if the partner has an unknown or detectable viral load. Have you been consistently using condoms during encounters? And lastly, have you been diagnosed with an STD within the past 6 months? So also some other questions to ask are, do you inject drugs? If so, do you have an injection partner who is living with HIV, sharing needles, syringes, or other equipment to inject drugs? Also, have you been prescribed with PEP, also known as post-exposure prophylaxis, and you report continued risky behavior or have used multiple courses of PEP? If you have answered yes to any of these, then PrEP may be a great choice to consider as a preventative measure. It is also worth noting that PrEP only protects a person from getting HIV, and it does not protect you from contracting any other STIs or any STDs. So, if you are a woman and have a partner with HIV and are considering getting pregnant, it is beneficial to you to speak with your doctor about PrEP, as it may be an option for you to help protect you and your baby from getting HIV while you are trying to get pregnant, during pregnancy, or even breastfeeding. As for adolescents, PrEP is approved for use by adolescents who weigh at least 75 pounds or who are at risk for getting HIV from sex or injection use. So, moving on, let's talk about ways that you can pay for PrEP. So, what do we know? Most insurance plans and state Medicaid programs do cover PrEP. There are also other programs that can help people obtain PrEP at little or no cost. So, what are those programs? Ready, Set, PrEP is a program that makes PrEP meds available to you for free. To receive meds through this program, you must 1, not already have drug coverage, 2, be tested for HIV with a negative result, and 3, have a prescription for PrEP already. And you can actually apply online, and that website is www.getyourprep.com. And I'll also share this at the end of the video for you to see. There's also a link on the website to get you set up with a healthcare provider to prescribe you PrEP as well. There are also copay assistance programs to help lower the cost of PrEP meds. Income does not affect eligibility. One copay assistance program that may help is the Gilead Advancing Access Program. So if you go to www.gileadadvancingaccess.com, and again, I'll share this at the end of the video on the blue screen, there's a number you can call with specialists that can assist and answer any questions you may have. There's also a number, and that number is 1-800-226-2056. And the website can give you more general information about the program as well. And there are also some states that have PrEP assistance programs. Some cover medication, some cover medical visits, lab costs, and some cover both. So visit www.nastad.org or nastad.org to find out if your state has a specific program. I checked the website and I didn't see Louisiana as an option, but there are other programs such as the Gilead Advancing, as well as the getyourprep.com Ready Set Prep that may be able to help. And so in Louisiana, if you need to find a provider for PrEP, you can visit www.louisiana.healthhub.org. That's www.louisianahealthhub.org, and in the search field, type in PrEP. There are also links to get questions answered by phone or by website. So that'll be it for this video. So in the next video, we'll be talking about the process of taking PrEP. So stay tuned for the next part, and I'll see you soon.